So promoting health. What is health promotion? So health promotion is described by different people, theorists, differently. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. And then Jean Watson, who's a nursing theorist, proposed in 1979 that health consists of three elements: a high level of overall physical, mental, and social functioning, a general adaptive maintenance level of daily functioning, and the absence of illness. Betty Newman describes health as an expression of living energy available to an individual. And we know that energy is displayed as a continuum, and with high energy, we have wellness, and on the opposing end, we have low energy, which is illness. Individuals have varying levels of energy at various stages of life. And then the final one is Myers, Sweeney, and Whitner, and they say a way of life oriented towards optimal health and well-being in which body, mind, and spirit are integrated by the individual to live more fully within the human and natural community. This definition includes lifestyles and habits as components of health and permits people who have been diagnosed with disease to be considered healthy. So how do you rescue health? So health promotion means finding ways to help individuals develop a state of physical, spiritual, and mental well-being. Health promotion activities are useful to individuals, whether well or sick, because they encourage optimal function. So if we have a patient who's obese and has a sedentary lifestyle, we would want to start by identifying what that patient's particular health promotion goal would be. And then we have Healthy People 2020, which was not met, but the goal was to attain higher quality, longer lives, free of preventative disease, disability, injuries, and premature deaths. We were to achieve health equality and eliminate disparities and improve health for all groups, and promote quality of health, healthy development, and healthy behaviors, and create social and physical environments that promote good health for all. So what's the difference between health promotion and health protection? Health promotion is motivated by the desire to be healthy. You want to have increased well-being. Health protection is the motivation of a desire to avoid illness. So say I had a family member who died of a heart attack at the age of 50. And now I'm 40 and I begin to exercise to improve my strength and endurance to benefit my health so that I do not die as my family member did at 50. So the protection is motivated by the need to protect their health based on something that's occurred to change their outlook. So health protection, again, motivated by the desire to avoid the illness. And then we have health prevention levels. So the levels of activity. So your first health prevention would be your primary. And these are activities that are designed to prevent or slow the onset of disease. So things that could prevent or slow the onset of disease would be eating healthy, exercising, wearing sunscreen, obeying seatbelt laws, and immunizations. Your secondary health prevention would be screening activities and education for detecting. So breast health examinations, testicular exams, regular physical examinations, blood pressure and diabetes screenings, tuberculosis and skin testing. And then the tertiary was focused on stopping the disease from progressing and returning the individual to the pre-illness phase. So the acute care setting would be an example of this, or rehabilitation. So what are health behaviors? These are health statuses that affect by health behavior. So when we talk about teenage pregnancy, pregnant teenagers are less likely to receive early prenatal care. They're more likely to drop out of school and to live in poverty than an older pregnant woman. The birth rate for teenagers aged 15 to 19 years is 20.3 births per 1,000 women in 2016, and it's down from 9% for 2015. Alcohol and illicit drug use. The risk of disease, injuries, and intentional deaths increases with substance abuse. Tobacco use. Cigarette smoking increases the risk of lung cancer, heart disease, emphysema, and other illnesses. Obesity. The risk of heart disease, diabetes, and stroke increases with obesity. And sedentary lifestyle. Exercise reduces the risk of disease and enhances mental and physical health. American adults have made little progress towards achieving recommended levels of physical activity or strength training. So we have our health promotion models, which are 3 different models. We have Pendler's health promotion, and this is 3 groups of variables that affect health promotion: the individual characteristics and experience, behavioral specific cognitions and effect, and behavioral outcome. This is based on 7 assumptions that reflect both nursing and behavioral sciences. Then we have our wheel of wellness, and that's what the image of this on your PowerPoint slide is. This is one of the spokes to the wheel, or the whole wheel is weak. The spokes of the health wheel represent the dimensions of health, emotional, intellectual, physical, spiritual, and social, family, and occupational. So the level of wellness from the center to the outward part of the wheel, and the center represents the least amount of wellness, and the outer part represents optimal wellness. If one area of the individual's life is not functioning at an optimal level, the life will not be as fulfilling as it could be, and therefore the wheel would not roll correctly. And the final is the theoretical model of change. In this model, change occurs in 6 stages. We have our pre-contemplation. There's no intention to change behavior in unforeseeable future because the patients are unaware or underaware of their problems. They do not yet contemplate change. Then we have contemplation. This involves the decision-making process. Preparation. Individuals are intending to take action in the next month and are changing or reporting small behavioral changes. Action would be the implementation of the plan. Maintenance allows the change behavior to be reinforced. Termination, which completes the maintenance. And then ideally the stages would progress in that order, but realistically a person may progress and regress in any of the stages. So health promotion programs, right? We have dissemination of information, and this is information may be disseminated at individual, group, or community level. And this is getting the information out there. So if we're talking about an individual, for the example, teaching a patient how to modify his or her personal dietary intake would be disseminating information to that individual. If we're talking about a group level, programs could include classes offered at local hospitals, prenatal education programs, and worksite programs. If we're talking about community level promotion, this would be programs directed at an entire community. We have changing lifestyles and behavior. So this would be offered group programs. They focus on activities such as weight loss, smoking cessation, exercise, nutrition, and stress management. They provide information and offer support. Many times they include maintenance programs to help solidify the change. We have environmental control, which promote health by working to create healthy environments. Programs focus on air and water quality, toxic waste, healthy homes and communities, infrastructure and surveillance, and global environmental health. And then we have wellness assessment and health risk appraisal. This focus on identifying behaviors that promote health and create the risk for disease. A wellness assessment tends to focus on healthy behaviors. It supports positive change to improve health. A health risk appraisal identifies risky behaviors that promote disease. Our health promotion program settings that we can have schools, which healthy teaching can begin at an early age. The nurses and teachers can regularly reinforce healthy behavior and redirect unhealthy ones. We have health clinics where nurses work in health clinics within large companies and may be contracted to provide specific health promotion programs, such as smoking cessations. Employers have found that health programs decrease work-related injuries and sick leaves. And these are just a whole bunch of different locations that you can see health promotion at, whether it's at your physician's office, inside a hospital, or community center. So your nursing assessment for health promotion. Obviously, we're going to want to do a health history and physical examination. This includes a thorough history and reviews of body systems and physical examination. Ask the client about family history and various health disorders and cause of death of family members. The level of detail of the physical examination depends on the health history. At a minimum, the exam should include vital signs, weight, body mass index, or waist circumference, auscultation and palpation of chest and abdomen, inspection of skin and palpation of peripheral pulses. The exam may be accompanied by lab studies and disease-specific studies. Our physical fitness would be cardiorespiratory fitness, which is reflected in the ability to perform large muscle, moderate to high intensity exercise for prolonged periods of time. There are many different models of testing, such as field tests, treadmills, stationary bikes, and step testing. Results depend on the age and gender. We have muscular fitness, which refers to both muscle strength and endurance. Muscle strength is a measure of the amount of weight of muscle can move at one time. Muscle endurance refers to the ability of muscles to perform repetitive movements. And we have flexibility, is the ability to move joint through its range of motion. Most common assessment is to evaluate lower back and hip trunk flexation. And our health assessments also need to be done by lifespan. So our health assessment and our promotion focus changes depending on the lifespan. So when we're talking about conception to birth, right, that's 40 weeks, 120 days. Health promotion focuses on education about pregnancy, abstaining from alcohol, cigarettes, and illicit drugs, nutrition, including folic acid and iron requirements, exercise to maintain strength and muscle tone, and to control weight. We want to do parenting education. Health screenings would be for your alpha beta proteins, screening for gestational diabetes, prenatal care, abuse. Additional screenings that we can offer would be ultrasounds, amniocentesis, or chronic villus simplex. Our neonate, remember these guys are birth to 28 days. Health promotion for them would be a safe birthing environment, feeding, bonding, placing infants on their back at sleep, naps, and that would be for naps and nighttime, not allowing infants to share their bed with their parent, using firm surfaces, There are screenings that need to be done on newborns, from blood tests, hearings, and heart screenings, all prior to them leaving the hospital. And then we have our infancy. So that's the 1 month to a year, and the health promotion should focus on nutrition, placing the infant on their back for sleep without a pillow to reduce the risk of sudden infant death syndrome, sensory stimulation, safety, motor vehicle safety, oral health, and vaccines. These health screenings are monthly examinations until 6 months of age, and then every 2 to 3 months, we want to check for their growth and development, and we always want to screen them for abuse. Our toddler and our preschooler, our health promotion focus needs to be on adequate supervision, safety, including storage of poisonous substances, toilet training, motor vehicle safety, nutrition, immunization, oral health, sleep and rest. Our health screenings would be annual examinations, growth and development, cognitive skills, abuse, and kindergarten readiness. For our school-age children, our health promotion focuses on nutrition, physical activity, safety, sexuality. We want to talk about stranger danger, oral health, and our healthcare screenings, our annual examinations, growth and development, cognitive skills, and continued on use. Our adolescents, our health promotion focuses on peer pressure, motor vehicle safety, safety in general, physical activity, self-esteem. We now need to start looking into suicide and depression, firearm safety, violence, sexuality, substance abuse, sun exposure, updating immunizations, and oral health. Our health screenings for these guys are going to continue to be growth and development. However, now we're going to start to add in mental health, stress, substance abuse, sexually transmitted disease, breast exams, and testicular exams. And of course, we want to screen for abuse. Our young adults, our health promotion will be physical activity, motor vehicle safety. We need to make sure that there's no violence. We need to assess their sexuality, substance abuse, limiting sun exposure, updating immunizations, and oral health. And your screenings, these guys are going to start to get comprehensive exam at least every 3 years. We're going to be assessing or screening for their lifestyles. Women are going to need pap smears and breast exams. They're both going to need sexually transmitted infection screenings. Men will need the testicular screenings. Both are going to need mental health, stress, alcohol and drug use, and abuse. For your middle adult, we're going to do physical activity, safety, obesity, sexuality, lifestyle, update immunizations, oral health, substance use and abuse, our health screenings, comprehensive exam at least every 3 years to the age of 40, and then yearly after 40. We're going to do blood pressure screenings, lipid panels, blood glucose, stress, mammography for women, digital rectal for men, prostate for men, annual eye exam. Everybody needs a colonoscopy and an upper GI series, stools for occult bloods, bone density, and abuse. Our older adults, so this is 65 plus, our health promotion is going to be on physical activity, nutrition, safety, obesity, sexuality, lifestyle, updating immunizations, and oral health. Our screenings are going to be functional skills. Are they able to do their activities of daily living? And are they instrumental in all their activities of daily living? How's their hearing? How's their fall risk? How's their stress? We're going to do eye exams, glaucoma screenings, blood pressure. Same with the lipids and the blood sugars, the mammos, the prostate evaluations, the PSAs for the men, stools for occult blood, bone densities, continued with the upper and lower GI series, mental abuse, and physical abuse, and mental health. So your assessments, right? Your nursing assessment, lifestyle, right, refers to the manner in which the person conducts their lifestyle, physically, emotionally, spirituality, and mentally. Lifestyle includes all of the activities that promote optimal living, such as taking responsibility for one's health, physical activity, nutrition, interpersonal relations, spiritual growth, and stress management. We can gather this information by interview or by using a variety of questionnaires. An example of a health risk appraisal is a questionnaire that evaluates risk for disease based on current demographic data, lifestyle, and health behaviors. There are many of these health risk appraisals available online. These are two of them. One's the Morse-Falls risk assessment. We use this one in clinical. The other one is a modified heart score as an example. This sometimes is used in emergency rooms to know if we need to really admit somebody for a full cardiac workup or if they'd be safe to discharge. We need to assess their life stress review. So based on Hans Sly's proposal that stress triggers psychological response that may over time induce illness. Likewise, Richard Raw identified some stress-inducing life-changing events and researched their possible effect on health. He attached numerical values for each change based on the degree of disruption or stress produced by the event. Raw discovered that high score on a life change event scale is associated with a greater likelihood of negative health change. Daily stress, which is created by travel to and from work, taking children to activities, daily chores, waiting in line, shopping, traffic jams. Researchers have found that these stresses may gradually erode a person's coping mechanisms, producing an inability to cope with daily events and increases the likelihood of illness. And hardiness versus vulnerability. You know, hardiness is a personality trait involving a blend of control, commitment, and challenge. It is what a person relies on to turn hardship and stressful events into a growth opportunity. Researchers studied a large group of college students who found hardiness associated with positive attitudes towards school and instructors. This trait was also linked to students' beliefs in their own inner capabilities and rated higher standards for learning. Those rated as hardy expressed satisfaction with life. There was an opposite association of hardiness with those that were experiencing depression, anxiety, and hostility. Health beliefs are embedded in one's culture and personal experience. Culture influences beliefs and practices, and we have that locus of control again here, and it's helpful to know whether health outcomes are a result of actions, and people with that locus of control are going to have that better motivated towards positive change. Our nutritional assessment, we need to check for dietary patterns, what the patient's body mass is, and then our health screening activities, our secondary prevention activities designed to diagnose specific diseases at an early stage so that treatment can begin before there is an opportunity for the disease to spread or become debilitating. Many of these screening activities are part of our usual care. For example, each time we assess a patient's blood pressure, we're performing a screening for hypertension. More health screening activities would be our lipid screenings, and our lipid screenings are going to change depending on our patient's age. Our dental health screenings right? Patients should have regular dental checkups to detect early signs of oral health problems such as tooth decay, gingivitis, or oral cancers. Colon screenings, both men and women should have occult blood testings, multiple stool tests every year beginning at the age of 45, and a screening colonoscopy based on risk factors. Breast cancer screenings, again, women should be familiar with how their breasts normally look and feel and report changes to the healthcare provider right away. We know that women need to be properly taught so that they do not have a false negative. Our cervical screenings, or our Pap smears, are used to detect cellular changes in the cervix. Women should begin cervical cancer screenings at 21. Women older than 65 who have had regular screenings with normal results should not be screened for cervical cancer. Women who have been diagnosed with cervical precancer should continue to be screened. Testicular cancer screenings, in spite of low prevalence of testicular cancer, men should be aware of a lump in their testicle or a feeling of heaviness or swelling in the scrotum, and they should report that. Prostate cancer screening is recommended against routine PSA levels, based screenings for prostate cancer, but understanding that some patients may request testing. We say yearly for digital rectal and PSA for men age 50 and older. If there's risk factors like a familial history, it changes the age to 40 to 45. And skin cancer screenings should be during any health assessment. And remember, we use that ABC acronym, which is asymmetrical, border irregularity, color variability, or diameter greater than 6. Rapidly changing lesions are also associated with an increased risk for cancer, or any suspicious lesion should be biopsied. So after we do our assessment, we go on to our nursing diagnosis, our nursing concept. We're going to note whether the patient's ready for enhanced wellness and describe the motivation desired to increase. And our outcomes are going to vary according to the focus area that we're promoting our wellness with. And our nursing interventions could be the role modeling, which is teaching by example. It could be individual counseling for face-to-face interactions. These can be helpful. And we can use our technology in counseling. When using technology to complete counseling, we can set goals and map out strategies for change, just as we would for our face-to-face counseling. Our health education may focus on self-care strategies, caregiver concerns, or on how to be an effective healthcare consumer. And our supporting lifestyle changes. Most clients need support to make change. We can provide support during our interactions and counseling sessions. And we can also help the client to identify available support resources within their community as well as from their family and friends. That is the end of this lecture. I hope that was helpful.